There's this one organ we almost never think about until, well, it starts screaming for our attention. But what if we paid a little more attention? Today, we're doing just that. We're taking a guided tour of the bladder, an absolutely essential and surprisingly complex part of you.
But before we get into all the nitty-gritty mechanics, let's just start with the question that really matters. How can you tell if your bladder is in serious trouble? We're going to break down the warning signs that you absolutely cannot afford to ignore.
All right, first things first, let's get to know the basics. Because really, understanding how the bladder is designed is the key to decoding pretty much everything else, from common little issues to the most serious conditions out there. So, what is the bladder? At its heart, it's basically a high-tech muscular balloon. It actually sits just outside the main cavity where most of your organs are. That's what extraperitoneal means. And its special lining, the urothelium, is incredible. It's designed to stretch as it fills up, and most importantly, it acts as a barrier, protecting the rest of your body from all the waste that's in urine. It's a simple concept, but man, is it effective.
Now sometimes, the bladder wall can form these little pockets or outpouchings. The technical term is diverticula. And as you can see, you can either be born with them, that's congenital, or you can get them later in life. The acquired ones are way more common, and they usually happen when there's some kind of blockage, like an enlarged prostate, that makes the bladder work way too hard for years and years.
Okay, this is a fun one. Here's a little anatomical quirk that can look like one of those diverticula, but it's not. On a scan, doctors might see something they call bladder ears. Sounds weird, right? But all it is a temporary, totally harmless little bulge of the bladder down into the groin area. It's actually a pretty common thing to see, and it's usually nothing to worry about. All right, we've got the anatomy down, now for the really crucial part. Let's talk about the signals your bladder sends when something is seriously wrong. And look, if you only remember one thing from this whole explainer, please make it this next point. This is the single most important warning sign. And here it is. That number, 4x, is absolutely huge. What it means is this: if you can physically see blood in your urine, what doctors call gross hematuria, your risk for bladder cancer is 4 times higher than if the blood is only visible under a microscope. The message could not be clearer. Visible blood is a major red flag. It needs immediate medical attention, period. And believe me, doctors do not mess around with this. This symptom is taken so seriously that there's a very clear medical protocol. If you're over 50 and you've seen blood in your urine, the standard of care is going to involve both the specialized CT scan and something called a cystoscopy, where they use a tiny camera to get a direct look inside your bladder. This is not a let's wait and see kind of situation. So that huge warning sign naturally leads us to our most serious topic, cancer. When abnormal cells start growing in the bladder wall, they can show up in a few different forms, and each one has its own unique causes and risk factors. Think of them as unwanted squatters. Okay, this table is basically your cheat sheet for bladder cancer. Let's walk through it. Top row, transitional cell carcinoma, or TCC. This is the big one, the most common by a long shot, about 90% of all cases. And the biggest association to remember? Smoking. Next up, squamous cell, which we're going to call the S cancer, for a reason you'll see in a sec. Then you've got adenocarcinoma, which is pretty rare and linked to a remnant from when you were a fetus. And finally, rhabdomyosarcoma, which is a pediatric cancer that often looks like a bunch of grapes on a scan.
So let's zoom in on TCC since it's the one we see most often. As you can see, smoking is the #1 classic risk factor, no question. But it's also really important to know that something as simple as urine stasis, which just means urine that hangs around and doesn't get emptied properly, maybe because of one of those diverticula we talked about, that can also raise your risk. These cancers usually pop up as these little cauliflower-like growths along the bladder lining.
You know, the source for this explainer had an absolutely brilliant way to remember the links for squamous cell cancer, and I just have to share this quote. It's all about the letter S. It's strongly associated with schistosomiasis, that's a parasitic worm infection, and with long-term suprapubic catheters. All start with S. It's just a simple, powerful trick that makes a key medical fact super easy to remember. Okay, let's switch gears completely. We've been talking about diseases, but what about physical trauma? What happens when the bladder itself actually breaks or ruptures? It turns out there are 2 very different ways this can happen, and they have different causes and need very different treatments. So, the most common type of rupture, making up 80 to 90% of cases, is called extraperitoneal. This is almost always caused by a pelvic fracture, and this is important, it can often be managed without surgery. The other, less common type is an intraperitoneal rupture. This is the one you hear about. It happens from a direct blow to a really full bladder, causing it to pop right at its weakest point on top. This one is a surgical emergency, every time.
And that more common rupture leads to this really classic visual sign that radiologists look for. It's called the molar tooth sign. When they're trying to diagnose it, they'll use a contrast dye in the CT scan. If the bladder has an extraperitoneal rupture, that dye leaks out into the space around the bladder, and it creates the shape on the scan that looks just like a molar tooth. It's a dead giveaway.
So we've seen how a bladder can get damaged. But what happens next? I mean, when it has to be removed, or it's just badly hurt, surgeons have some truly ingenious techniques for rebuilding the whole urinary system. And this is where surgery gets really, really cool. After a bladder is removed, that's called a radical cystectomy, surgeons can actually go in, take a piece of the patient's own bowel, and totally repurpose it. They can create a simple channel to divert urine out of the body, or they can even build a whole new internal reservoir that acts like a brand new bladder. It's just amazing.
And here is just a fantastic example of that surgical problem-solving in action. It's called a psoas hitch. So imagine part of the ureter, that's the tube from the kidney to the bladder, gets damaged. If the leftover piece is too short to reach the bladder, surgeons can do this. They gently pull the bladder up and literally hitch it to the big psoas muscle nearby. It just closes the gap and lets them make that crucial reconnection. Just brilliant.
So we've covered a lot, right? From the basic anatomy to some really serious diseases and these incredible surgical fixes. But if there's one big takeaway, it's this. Your bladder rarely suffers in silence. From little changes in your habits to that one critical can't-miss warning sign of visible blood, it is sending you clear signals. The only real question left is, are you listening?